Hi everyone. In this short video, we are going to look at these vocabulary terms. We will look at the difference between an observational study and an experiment, the difference between an explanatory variable and a response variable. We will talk about lurking variables. We will look at the difference between a control group and a treatment group, and we will talk about placebos. Let's start with observational study versus experiment. In an observational study, we simply observe and measure something that has taken place or is taking place while not causing changes. For example, does family income affect a student's academic performance? In that study, we would simply collect information and try to find connections among that information. There's no change that we can cause. We cannot have an impact on family income. Another example is, does height affect income? So some people say that the taller you are, the more confident you are, which leads you to become more successful in your career, which leads to a higher income. Let's say we wanted to test that out. Again, we would simply collect information and try to find connections. We would collect the height and income of different individuals and see if height affects income. There's no change that we can cause. We can't change a person's height. In an experiment, we impose some change or treatment and measure the response. For example, does aspirin help lower blood pressure? If we were to perform that experiment, we can impose some type of change because we can change the aspirin dosage that we are providing for individuals, and then we can determine whether that change helped lower blood pressure. Another example is one brand of fertilizer more effective at growing roses than another? The change we're imposing is the type of fertilizer we're using. Let's look at explanatory versus response variable. The purpose of an experiment is to investigate the relationship between two variables. We want to know, is there a connection between the two variables? And we have a name for these two variables. When one variable can cause change in another, we call it the explanatory variable. The affected variable is called the response variable. And a way to remember that is basically by looking at the name. The response variable is the variable that's measuring a potential response. So again, let's use the example that I mentioned previously. Does aspirin help lower blood pressure? In that example, if we were to perform this experiment, the explanatory variable would be the aspirin dosage because this is the variable that can potentially cause some type of change. The response variable is the variable in the experiment that could potentially be affected. So in this case, it's the blood pressure level because the blood pressure could potentially be affected by the aspirin dosage. Let's look at lurking variables. Lurking variables are basically other variables the researcher failed to control that may affect the response variable. And a way to remember it is again by looking at the name, lurking. Lurking means we may not expect it to have some type of change. We might not see it coming. So if we look at the same example from before, remember we said the explanatory variable was the aspirin dosage and the response variable was the blood pressure level. But when analyzing different participants in an experiment, their blood pressure might potentially be impacted by other factors beside the aspirin dosage that they're taking. These other factors are weight, diet, and whether or not they smoke. So these would be considered lurking variables. Typically, someone who is overweight or is heavier is more likely to have higher blood pressure. If you have an unhealthy diet, you're more likely to have higher blood pressure. If you smoke, you're more likely to have higher blood pressure. So these are lurking variables that can affect the data. Now let's look at a control group versus treatment groups. The different forms or levels of the explanatory variable are called treatments. The control group receives no treatment. However, an experiment doesn't necessarily need to have a control group. Let's look at this example. Let's say a hospital wants to test the effectiveness of a pain reliever after intensive surgery. Different patients may receive different dosages, so these would be the different treatment groups. For example, one group might receive a 200 milligram dosage, another might receive 300 milligrams, another might receive 400 milligrams, and then data would be collected based on what we observe among these different groups. The control group would not receive any form of treatment, so the control group could receive a sugar pill, and a sugar pill means that there's nothing in the pill. It looks like a pill, but there's nothing in it that would physically affect you. And you might be thinking to yourself, what's the point of that? Why would we give someone a sugar pill in an experiment? The purpose is because of the placebo effect. The placebo effect refers to the fact that people may respond to perceived treatment, meaning treatment that they think they're getting, even if the treatment will have no physical effect on the response variable. Placebos are basically fake treatments, and they're used to prevent subconscious reactions that can occur when subjects know the treatment that they are receiving. Just like we saw before. If you give a patient a pill and you tell the patient that pill is meant to alleviate their pain, they might process this and have a psychological effect that makes them feel like they have less pain, when in reality there was nothing inside the pill. To give you a better idea of this, I found this picture in which we're looking at the scientific reasons behind the placebo effect. Here we're seeing a doctor giving a patient a pill. Because of this, the patient has these expectations of what's supposed to happen. These expectations could release endorphins or dopamine, which would cause pain relief in the patient's body. So to summarize, a control group can receive no treatment at all, or they may receive a placebo treatment. So not every single experiment is going to have a placebo. Some experiments might have the control group not receiving any type of treatment. Let's look at one last example to give us a better sense of all the terms we just discussed. The Smell and Taste Research Foundation conducted a study to investigate whether smell can affect learning. Subjects completed pencil and paper mazes multiple times while wearing masks. They completed the mazes 3 times wearing fluorescent masks and 3 times with unscented masks. For each trial, researchers recorded the time it took to complete the maze. We're going to identify the explanatory variable, response variable, possible lurking variables, treatment group, and control group. Remember, the explanatory variable is the variable that's potentially causing change. That would be the scent of the mask. Remember, the response variable is the affected variable, the variable that's being affected by the explanatory. So in this case, the variable that's being affected by the scent. That would be the time it took to complete the maze. Remember, lurking variables are other factors that can affect the response. In this case, one lurking variable could be the person's sense of smell. Some people have a strong sense of smell. Some people have a weak sense of smell. Another factor could be the person's scent preferences. Not everyone likes floral scents, so that could turn a person off and potentially affect how they perform on the mazes. The treatment group receives the treatment, so in this case, it would be the participants or subjects that are taking the maze while wearing the fluorescent masks. And finally, the control group does not receive the treatment, so in this case, it would be the participants that are taking the maze with the unscented mask.